Right. I think we should begin the session since we have attendees logging in. I'm sure more of people will be logging in at any time now. Hello and good evening, everyone. Hope all of you are doing great. I'm Shreya, and on behalf of NASSCOM, I would want to welcome all of you for yet another interesting webinar by the NASSCOM product team. Today, we will be covering an interesting topic, and the discussion is on challenges in the health tech product management. To cover this session, we have Mr. Nitin Vashne, who is the Director of Product Management at Optum and is also the co-lead for the NASSCOM Product Skilling Charter. Before handing over the session to Nitin, I would just want to make a few hygiene announcements. All the attendees will be in the mute mode only throughout the session duration. Nitin would prefer to take questions at the end of his presentation, and which would be briefly about 45 minutes to 50 minutes. So we will keep 10 minutes in the end for the questions and answers, but at any point in time while he's covering all of this, if there are questions from your side, we would request you to put that in the Q&A box, during the session or after the session. Nitin would pick the questions, and try to answer most of them. If some are left unanswered, we will, my colleague and I will put together that, and we will share the replies with you post this webinar. So I would now like to hand over the session to Nitin. Nitin, welcome, and over to you for the discussion. Thank you.
Thank you so much, Shreya. I hope I am audible and visible.
Yes.
Thank you. Thank you so much. And I'll kind of put this disclaimer from NASSCOM for a few seconds here for everyone to kind of read. This is an important disclaimer about the session. And then I'll move to to talk about for a minute about the organization I work for, that is Optum. And at Optum, we are dedicated to helping people live healthier lives and helping make the health system work better for everyone. Optum is a health services company. United Health Group is our parent organization. UHG is ranked 5th of the Fortune 500 with a full year revenue of $287.6 billion in 2021. UHG is a diversified enterprise with complementary yet distinct business platforms. Optum providing health services, which are like based on information and technology, and United Healthcare providing health benefits. Optum delivers simple, effective, and comprehensive solutions to organizations and consumers across the whole health system through our 3 business units: Optum Insight, Optum Health, and Optum RX. So with that, let's delve deeper into the session. As Shreya kind of set the context about health tech product management and challenges and the art of possible. I want to just start with where did the ecosystem started and what were its objective, and then how are we evolving as an healthcare ecosystem. So before 2008, the focus was primarily on ensuring right quality care. That means when the care is actually required and when the actual care is actually provided. So that was the time when industry was measuring quality on the parameters of safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. And then in 2008, Institute of Healthcare Improvements, IHI, proposed this framework, which became extremely famous, and that is Triple M. Triple M focuses on basically 3 attributes of any health system, health ecosystem, and how any health ecosystem or country try to balance it out between these 3 important parameters, which is improving health of population, elevating patient experience and access, and reducing cost of care. Now, this became the guiding principle for healthcare systems and countries all across. And it's kind of it's very simple to understand, how do you balance between improving the patient experience of care, which includes quality and satisfaction, Second, improving health of population, which includes risk status, functional status, level of chronic diseases, and vital parameters like mortality and life expectancy. And the third, reducing the per capita cost of healthcare, which primarily kind of also focuses on the utilization of healthcare, infrastructure, including hospitals and ED. Uh, and so, while Triple Aim takes care of foundational or fundamental elements of healthcare system, that is quality, access, and cost, it puts the healthcare workforce in tremendous pressure of achieving the balance between the three aims. Provider face widespread, burnout, dissatisfaction, and a really pressure situation, which leads to medical error and patient dissatisfaction, and also most importantly, the provider or the physician turnover. Currently, the turnover for physician is at 6 to 7%, which is pretty high. The burnout is mainly due to financial restrictions, increased documentations for quality reporting, non-clinical processes and documentations, prior authorization processes, and shortage of medical talent. Overworked provider community is also not good for healthcare businesses, as their active participation is key to the next wave of industry transformation, like value-based care. So in 2014, triple aim was like further enhanced to quadruple aim, with the addition of fourth aim to enhance provider experience and well-being by improving the work-life balance of healthcare providers, including clinicians, nurses, staffs, while simultaneously achieving the triple aim. And so this was highly appreciated by all the healthcare entities, especially the provider community. But in 2021, there was a fifth aim added to it, and that was on health equity. Now, health equity focuses on reducing the health disparity in the health ecosystem. And there is a moral and business need to ensure that everyone has a fair opportunity to attain their full health potential. To achieve the quadruple aim, health system will have to actively reduce health disparities in the population. Health inequity causes poor health outcomes, costs all healthcare entities, and impacts the provider experience by putting healthcare workforce under pressure to treat unavoidable complex cases. So this important aspect of the fifth aim is to reduce health disparity based on what we say as social determinants of health, which are like primarily non-healthcare parameters like socio-economic status, racial and ethnic group, gender, age, etc. So this has been a wonderful evolution of healthcare ecosystem objectives, and this is like very closely monitored and used across the countries to see the performance of their health ecosystem, and kind of become the guardrail for how to balance it out for the best performance of any healthcare ecosystem. Now, I'll take some time to kind of also talk about the value chain of health ecosystem, and the value chain across the geographies, across the ecosystems is pretty complex, and so it's not easy to kind of cover even a certain part of it in 1 hour session. But what I will do is I'll kind of give a little bit high level overview of the value chain of healthcare across the industry, across the geographies, and there are nuances of it, as you apply it across the geographies. But moreover, this looks, and is applicable everywhere. So, as it is kind of true for any industry, even in healthcare, the consumer, or many a times those are patients, are at the center of this ecosystem, and the problem in healthcare is that the segmentation within the healthcare for consumers is very complex and very varied. But you can categorize them, and I've tried to kind of categorize them into few very high level categories. Like first is healthy, which has no serious health issues, fitness focus, and their need of regular checkups. Then at risk, larger population which is at the borderline of one of the chronic conditions, and their focus is on preventive care so that they don't really get that chronic condition for which they are on borderline. Then you have chronic condition segment where folks who have one to four chronic diseases, mainly like some of the complex chronic conditions include heart diseases, diabetes, arthritis, and asthma. And so this segment kind of focuses on how do they use the digital assets for tracking their health and ensuring that they come out of that risk or the chronic condition which they have found themselves in. And then the higher equity segment starts, like complex segment which has like 5+ chronic conditions. Their main need is for high medication adherence, and also their interventions on intervention requirements of remote patient monitoring, because they would like very high oversight from their providers and doctors and medical staff. And then behavioral, especially the complex segment, because of various reasons, they do get into behavioral issues. There are behavioral includes mental health, family councils, substance use, and the addictions, and those problems. So overall, that's a different segment altogether. And then end of life, where the patients or the consumers are dealing with the terminal illness, and hospice care is like one of those intervention types they are kind of rely on. Now, if you look at the different entities together, for example, government, the role of government is focused on regulations, where they are kind of focused on protecting the public well-being and the pursuit of the quintuple aim, as I was kind of talking about earlier, and encouraging the medical research for future. That's like and in those area, government kind of comes up with heavy regulations. There are lot of regulations which the countries have kind of established. For example, in US, there is a HIPAA regulation which focuses on ensuring coverage for every individuals, and Affordable Care Act or Obamacare, which focuses on the maturity of the healthcare ecosystem, from moving from the FFS, where the reimbursement happen for every service, rather than on that, the how do you kind of move to the value-based care, where it's not about how many treatments you did, but also it's more on how well you treated the patient. And in India also, like we have regulations like Clinical Establishment Act 2010, which kind of establish minimum standards for facilities and services. We are like there's a lot of talk on universal healthcare, Ayushman Bharat, National Health Protection Mission, like overall kind of targeting some of these programs targeting 100 million plus population. That's a very, very huge initiatives, regulations kind of underway and already kind of in the works. And then comes the federal and state programs, where they are talking about they kind of focuses on their role of supervision and oversight. Important things like performance rating for all the entities, and incentivizing them and disincentivizing them in one way or the other. Important initiatives like disease control and prevention, which we have seen in action during COVID, and very important in at any given point of time. And then we have associations like medical associations, medical practitioners associations, which kind of sets the ground rule for practice all across, and the regulations around approvals on patents, medical devices, and whatnot. For example, in US, FDA, which have very stringent requirements for any products to be out in the market. And then public health. That's another very important responsibility of any government: preventing disease, prolonging their population health, and promoting health, and taking care of social determinants of health. So government is one of the major funder for all the programs or the healthcare costs, and so is employers, right? So folks who are salaried folks get their healthcare coverage from their employers. So one of the primary decision which an employer makes is whether to be self-funded or fully insured. Self-funded kind of pays the healthcare bills of their employees on their own. They have that kind of confidence, and that's fully insured kind of do not want to take that risk and go to a health insurance company to kind of take that coverage. So we have these kind of examples in all the geographies. Then we have payers and insurers, where the primary role is to kind of establish health plans, basically insurance coverage at the cost of premiums. And those premiums are based on the risk, kind of set by actuarials and leveraged by underwriters to kind of sign, define the contracts. The reimbursements for these transactions happen after the thorough claim adjudication process. And so that's like the payer main responsibility. Like they are the keeper of the managed care. They build provider networks, ensure that the patient responsibilities are as minimum as possible, and also the network adequacy is really good for the population they are covering. Network adequacy would mean analyzing their population and trying to understand how many specialists would be required, how many physicians would be required, and really signing those many contracts so that the population has easy reach to them. And obviously kind of also setting some discipline in terms of out of pocket expense, so that members also try to take care of their health and not rely on healthcare infrastructure for everything, right? And so with that, the next one is on the PBMs, the pharmacy benefit managers. Primarily, you will see in the developed world, like the pharmacy benefit managers kind of you know are the intermediaries between the payers, drug manufacturers, and the pharmacies. And they will kind of work on behalf of payer and try to set a formulary and also negotiate the rebates and the costs and the prices for the drugs which are being used in the network. So they play a very important role. And then the CDHPs, are the term which is used in US, where the health insurance is not just about reimbursing the claims after the treatment is done, but also involving patient into that value chain, that they set aside some premium for the members, which they can take home in case if they are able to take care of their health well, and if they don't leverage that amount for any of the healthcare needs. So those accounts typically are tax advantage accounts, and those benefits are pretty heavy. So consumers do actively participate in taking care of their own health. And then you have providers, like we all understand hospitals, but the breadth and depth of hospital responsibilities is like really wide. Starting from surgeries, ICU, ED, inpatient, outpatient, the auxiliary services available in hospitals, be it diagnostics, pharmacy, pathology, and the specialty departments, general hospitals, acute care, medical research, to kind of really take the medical kind of practices forward, and also supporting the medical education. And then not just hospitals, you have an alternate care setting, the less expensive, easily accessible alternate care settings like ambulatory surgical centers, urgent care centers, and nursing centers, and retail clinics and whatnot. So these are like many of these are just kind of getting started or getting established in a big way. this is what Professor Clayton, kind of recommends, that how to kind of really go from the most central and the most acute setting to the settings where the lower acute, the treatments can be provided in the lower, least costlier settings. So this will become the guiding principle for all the geography based healthcare ecosystems going forward as well. And then last but not the least, pharmacies dispensing prescriptions, doing the drug utilization review, ensuring as the pharmacies will get mature, they will be able to stop some of these unnecessary treatment or avoidable issues like drug to drug interactions or drug to allergy combination and whatnot. So this is like some of the the developed countries already have very intelligent pharmacy workflows, and I think it will continue to kind of move forward. Obviously OTC medication and prescription drugs coverage is there for most of the pharmacies, and there are concepts in some part of geographies of community pharmacy, wherein not just dispensing drugs, but also kind of examining some of the lower acute conditions and kind of taking care in the community pharmacy itself. And last, in that particular sense, producers, if you see, the again, pharmaceuticals, as we were talking about, like the higher responsibility of discovering, developing, producing, and marketing drugs, which is pretty heavy lifting in terms of kind of taking drugs from innovation to the usage, and not just doing that for patented or branded medication, but also kind of getting into generics, and as well as kind of producing some of the medical devices, especially used for specialty drugs like infusion services. And then you have industries, like every word on this slide is more like every in itself as a subject and an industry. Like, for example, medtech, medical devices for diagnosis, patient care, and treatment. MRI, CT, PET, catheters, the medtech devices used in the robotic surgeries and whatnot. And then you have biotech, wherein some of the genetic engineering and bioengineering plays going on to really enable the personalized medicine using the organisms genes, and also using natural sciences of tissues, cells, and molecules to really take the pharmaceuticals to the next level altogether. And the surgical supplies, like all across, getting matured, whether it is cutting surgical instruments, grasping surgical instruments, or retracting surgical instruments. And so this kind of is a very large landscape of producers itself. And I'm not, kind of, covering few more producers segments here. And all these major entities like consumer, government, employer, payer, providers, and producers, all of them, have to, on one hand, take care of their core competency. Like, for example, core competency for provider is care, and core competency for payer is providing the risk coverage. And then government regulation, right? So they have their own core competencies, but they have to work together in synergy, following the regulations, keeping consumers interest at the center and whatnot. So therefore, beyond core competency, whatever works are there are always intermediaries and support organizations which kind of really take care of this. So for example, clearinghouses. Providers have to submit, doctors have to submit claims and whatnot, and they are not really that is not their core competency. So how do you How do you involve clearing houses to do the real time and batch transactions, ensure that they are following the right protocols, the transactions are going to the right channels. The wholesalers, how do they intermediate between drug manufacturers and pharmacy? How do they do multi to multi kind of interactions between the manufacturers and pharmacies? And also, how do you kind of take care of the return supply chain? And then you have a lot of associations, be it associations for organizations executives, be it for quality standards, disease specific, the profession specific for surgeons or nurses, or geography specific. So there are a lot of associations which have always been there to kind of really be the voice of a particular entity and ensure that they raise the concerns, and then kind of establish the rules for all, the entire ecosystem to mature to the next level. And all of these entities require a lot of technology innovation, focus on consumerism. They need digital assets to make this all happen. They need a lot of data. They need platform which can aggregate this data, make sense out of this data, analytics, and common competency platforms, right? So there are technology enablers. Now, again, technology enablers doesn't mean that it has to be outside these organizations. It could be in-house, or they can partner with like the pure play technology enablers. But the technology enablers are the real, enablers, to kind of ensure that these entities are working in synergy and keeping the consumer at center. For example, government, how technology enablers help government in population health and public health, taking care of the underprivileged and people with lesser access to the healthcare and primary care. And then the payer, how do they kind of really do a sharp risk coverage analysis? Providers, how they can kind of provide the care in the best possible way at the right time, at the right place. And how can digital assets enable that? And producers, how do they go direct to consumers? And over the counter and diagnostic services, how do they kind of ensure that the population get the access to the diagnostic services in the easiest possible way, right? And then the intermediaries, like kind of how they rely on technology enablers to find faster and agile ways to take care of the administrative burden and the compliance requirements. So that's like the value chain. Again, no way I can cover this in 1 hour. If every word on this slide is a deep subject in itself, and this is an indicative high-level view, there is the real healthcare value chain will be much more larger. So I wanted to touch upon very important topic. I've always heard people asking me, like, why is healthcare complex and how is healthcare different from any other industry and whatnot. So I wanted to address this, like, why is healthcare complex? So there are bunch of reasons why it is complex. One is wide spectrum of healthcare needs. So the segments are very complex. Within a segment, there are a lot of complexities. There are a lot of parameters at play with respect to chronic diseases, lot of permutation combinations and whatnot. And the needs for each of these segments is really varied. So that's like the most important reason why it is complex. Second reason is highly regulated. This is, I think, if I'm not wrong, it is the highest regulated industry in any geography. And the reason is because obviously the lives are at stake, population health are at stake, population productivity is at stake, right? So therefore, it's very highly regulated, and government rightly so regulated properly. And it could be any government, right? And you have data. So the healthcare data has its own problems. It is the norms for security and privacy for healthcare data is much harder and much stricter than any other industry. So, that there are like several rules which kind of dictates what who can access, what they can access, where they can access, and what not. So that makes it really tough for, especially for experimentation and innovation. The regulations for innovation kind of are stricter because new product have to comply to a lot of rules, and that makes any product life cycle longer than any other industry. There are multiple dynamic partners. The value chain I covered, although it is indicative, but you could see the complexity in the value chain, and not just this, that the value chain is complex, but also because the collaboration is so critical, and, and yet it is so limited and so slow in the healthcare ecosystem that it makes the healthcare complex. The progress like are always slow in healthcare for that reason. Then you have social determinant of health. Interestingly, a lot of problems in healthcare are due to non-healthcare reasons. So, for example, socio-economic reasons, access to the healthcare, their quality of housing, quality of food security, transportation. These kind of causes the healthcare problems. So you cannot solve healthcare problems by solely being in healthcare. So that is another level of complexity there. And then consumerism. Today, if we have to interact with someone, if we have to watch something, if we have to do transactions on something, it's so easy. Outside healthcare, people get ultra agile, ultra fast experience, and that cross industry comparison is so critical. People get that, and people want the same experience in healthcare. um, One of the fact that 43 percent of healthcare services can be shoppable, but only 7% of them are actually shoppable. So things of those nature, health tech can play a big role, and I will double click on consumerism in a bit here. The another complexity is because balancing consumer care needs and the business fundamentals. So it's on one hand you will have to, the ecosystem will have to manage the balance between the five aims and quintuple aim, but also while taking care of it, you will have to think about sustainability, business viability, and feasibility. So how do you balance it between the two is also an uh, area of complexity. Technology impact, it's a healthcare is little known for being laggard for obvious reasons in technology adoption, but it's maturing. The data flows are getting matured, and the only thing is that the data, especially the type of data and the protocols for the data exchange, are really complex. And so, how do you kind of really take care of it is going to be an important aspect to solve this complexity. And then population versus individual health. If you look at it from the government lens, they are always worried about population, varied intervention strategies, risks stratification, and whatnot. While if you look from the provider perspective, they are more worried about the individual health, personalization of care, and so on and so forth. So, so from that perspective, these are the. I'm sure there are more parameters which make healthcare even more complex, but I had to put something out there with respect to what are the top 8 reasons because of which we can easily say healthcare is really complex. Um, while we talk about complexity, I just wanted to also go back one step and talk about the consumer segments, right? In consumer segment and the perspective of the cost versus the population, which is key to understand the complexity of for healthcare from that lens. Um, so, for example, the 40% of population is either healthy in general or at risk of one chronic disease in next 5 years or so, and their involvement or their usage of cost or the budget for healthcare is just 10%. um, Healthy in general, they don't have any serious health issues. Their needs are regular health checkups and self-awareness and education, while the interventions are mostly digital, social, mobile, health tracking. They are looking for fitness and nutrition coach and preventive care. While at risk, segment is looking for very specific education, medical education for that particular risk. For example, if somebody is at the borderline for diabetes, they are more interested in, okay, what else I can do, or what else could happen to me, and things of those nature. Self-management, regular checkups, adherence to medical plans is like the key need for them. And the intervention, obviously, preventive care, symptoms tracking, and immunization. And so interestingly, this also tells, on one hand, we would want to believe it's a good story that 40% people taking only 10% cost, but it also tells a story that preventive care is not really kind of given that focus in the industry. And the reason and the impact of it is that as the consumer grows old, they easily get into from healthy to at risk to chronic. And one of the foundational reason is that we have not spent enough on preventive care. So if you see from chronic segment perspective, almost half cost and population, um, you know they're again looking at one or more chronic conditions. Their need is for symptom control, treatments and therapies, social support, and affordability, most importantly, because most of these chronic condition population members are unable to manage the cost associated with their treatment. Interventions like really on the acute care, hospitalization, digital health tracking, and telemedicine. And then very important one is like the last one, where we are covering polychronic and end of life, like 12.5% of population. That takes up 41%, like more than 40% of the cost. Um, Chronic conditions, like more than five conditions, there are certain death risk because of their polychronic conditions. Their very high need is high medication adherence, and healthcare cost controls, because this is a segment which is tremendously under cost pressure. Specialty clinic, remote monitoring, integrated behavioral health, because polychronic conditions always give rise to behavioral health issues, always. And so how do you kind of really help them there? And then end of life, the terminal illness segment, focusing on practical assistance, respite care, and then palliative care, hospice care, and the legal advisor. So it tells a story. And if I have to take one takeaway only from this entire analysis, is that we are not investing enough on preventive care. And so I wanted to kind of delve a little bit further on consumerism, I would like to, as I was saying in the previous slide, that there is a cross industry comparison in healthcare. They consumer today want the same experience or agility what they experience in other industries. So this is very important. And I always believe that this is one area where health tech can really play a big role. This is where we have done in other industries, and we can do it in healthcare also. So I'll put it in quintuple aim lens. Like for example, for improving health of population, more than 80% of individuals' health and well-being is influenced by non-clinical factors like SDOH factor. That's like very, important to note. And then reducing cost of care. Today also a lot of reimbursement and financing happens based on fee for service, which means the payments are happening based on how many services were provided versus how well the services were provided, right? And so over prescribing is one of the side kind of effect of that, because more they prescribe, more reimbursement or more money flows into the system. And so that's one of the massive problem there. 33, and again big problem, 33% of medical procedures in the US turn out to be unnecessary. Imagine, one third of the procedures are unnecessary. And health equity, again, not having access to the right healthcare, having the high disparity of achieving the full potential of the health is one of the big problem. High wait times, unequal quality of health across segments. These are like health equity issues which are directly related to consumerism. And provider experience, because there is an unpredictable and high demand for treatments, like the workflows are also not very optimized, and there is always time pressure. And one important factor why this industry differs is because of the stressful and emotional nature of the industry. It's in that zone, it is really, especially our providers, medical community is always under pressure to really optimize their processes and achieve the best health, and also do that all of that in stressful and emotional environment. And then last but not the least, because this is the core of consumerism, which is elevating patient experience or access, which is like ability for consumer to make decisions. So they are not able to make decisions, and the core reason is that they don't have access to the information. So consumers don't have all the information to make the right decision, and so they always rely on the medical professionals and the medical workforce to make the decisions, and not the medical communities issue also, because the information symmetry is not there. It's very The information behind the scene also is not easily available to the healthcare community, and so personalization of care is a big issue due to that information asymmetry. And so now let me very quickly also touch upon what are the areas where we can do something, right? So improving health of population, obviously, removing that SDOH factor, or at least kind of making an attempt to bring in all the non-clinical factors into the decision making, for the care is going to. So how do you kind of integrate that and make a holistic view for the decision making is very important. And then reducing cost of care, whether it is one third unnecessary procedures, or any other factor. How do you really integrate the healthcare entities in such a way that the care is continuous and personalized, and they eliminate all the duplicate care which is happening today. Health equity, obviously, how do you increase the access for the health interventions? How do you serve all the segments without any bias, without any disadvantage? Eric Topol said that AI offers the opportunity to restore the precious and time-honored connection and trust between patient and doctors. So how do you leverage AI to that level? Is going to be a challenge for health tech community. And provider experience, need for tools and platforms that can stratify patients based on their clinical needs and reduce administrative requirement, leading to significant medical errors. Medical errors is a very big issue in healthcare, and there are a lot of startling facts around medical errors, and many a times it is because the systems are not talking. There is no big picture, there is no complete picture, and so technology can help that issue at the root cause and reduce medical errors, save lives, improve lives. Elevating patient experience, need for decision support and educational tools. So this is one interesting kind of thought there, that imagine without decision support, choosing healthcare packages is like visiting a supermarket where the packaged goods offer no label information. Can you shop in a supermarket where there are no labels today? And that is the experience of consumers today, that they have to make decision, if at all they are allowed to make a decision, they have to make a decision without any information. So how do you kind of make them enable them for that decision making? I'll kind of wrap it a little faster because I think I'm running a little slow. So this is like for everything you need good data for training your algos and improving your workflows and whatnot. And so I'll take one most critical piece of healthcare data, which is consumer data. And so holistically, if you have to look at consumer data, it is not just about their last historical clinical records, which is kind of generally a layman person will understand. But if you have to really create a good view of consumer data, you need demographic data, patient generated data, social structure data, social media data, biometric, pharmacy, claims, clinical history, IOMT, genome, RPM, health finance, health and wellness, and socio-economic data. And then you get your complete picture of a consumer. And all of that data need to be accurate, valid, reliable, timely, relevant, and complete. Again, I know we are talking about the most the perfect scenario, but that should be the target. And as close as you can go, it will be important for consumer data to enable the digital health. Many a time, people will doubt that analytics did not do its job because the data was not complete. The digital health will not be able to do its magic without the data. Again, if you have to look at digital health, how can it enable the consumerism in healthcare? So there are a lot of things which the health tech community can kind of pursue, and I wanted to kind of look at it from the horizons perspective. Like for the first horizon, it is infrastructure or foundational capabilities to kind of strengthen the data and analytics platform, modernize the patient portal. Or patient portals were always there, but those were like so transactional and so unhelpful in many ways. So how do you modernize them, give what patient wants, optimize the digital and digitize the processes? A lot of manual work happening which can easily be digitized in healthcare industry. Horizon 2, digital front door, not just enable patient to access the clinical records, but also involve them in the decision making, involve them in every aspect of quintuple aim. And the digital front door will be one of the primary way to achieve that. Virtual care, not just telemedicine, but also other aspects of it in a hybrid way. How do you go seamless from one care setting to another care setting and whatnot? Pharmacogenomics based medicine, how do you kind of bring in gene analysis into the care pathways so that it is the care and the medicine prescriptions are very personalized and very effective. Wearable IoT devices, I know that consumer tech industry has taken a lead on it, but I think the leveraging all of that data, how consuming all of that data in decision making is going to be one of the horizon 2 objectives. Social. So we have all heard about digital twins. It came from space tech and manufacturing industry, but in healthcare, if you have to enable digital twin, the most effective digital twin will have to take SDOH data into account. And then it will be really working as magic as it worked in the other industries. Prevention and wellness apps, communication enablers, healthcare API. Today, startups look for a lot of data, and a lot of companies and a lot of entities are looking for easy access to data. So how do API marketplaces play its role in healthcare? And then connected things platform is going to be the horizon 2 objective as well. On the horizon 3, how do you remove the complete friction which is in the financing, health financing for all of the parties involved, is going to be an horizon 3, kind of objective. Um, Here we are, robotics and 3D printing enabled surgeries. I know it's already happening, but what we know is only an exception, and it is not the norm. How do you take it to the every nook and corner of the country and the world is going to be the next big challenge. Blockchain, leveraging it for true source of information. There's a lot of talk, but we have not yet reached a point where we are able to maintain a true source of information, leveraging blockchain for the healthcare clinical data. Hospital at home, omni-channel engagement, super apps for healthcare. All of these are horizon 3, kind of possibility. I'm rushing because I'm almost like out of time here. Um, and kind of just summarize it in the last slide with the art of possible for health tech, be it in normal life, for population health, predictive model risk scoring, prescriptive care plans, or monitoring health, leveraging IOMT and wearables, or doing the omni-channel outreach, very specific outreach, ensuring that we predict the onset of any chronic disease for anyone, and kind of reaching out and deploying the preventive care interventions right there in pre-care. Like how do you bring in the consumerism aspects into it, make it seamless for the consumers and the patients, apps, kiosks, and prepare the patient longitudinal patient record like early in the the cycle, so that it kind of builds up, and it will be very very useful as the journey goes to the next stages. And then seamless enrollments and the processes are associated with it. Then you have receive care, segment, where you have telehealth, virtual visits, mHealth. How do you kind of leverage the mobile or the portable devices for really enabling telehealth to the next maturity level, care transition, effective referral management to specialists, CDSS, that to AI powered, um, e-ambulance systems, which will enable the treatment, in the virtual way, with the help of the experts, and then improve utilization all across billing and payment. Like as I was saying, remove the friction. Like this friction, the one of the things which retail tech did was that they removed the friction from payments completely. And healthcare still deals with billing and payment and friction, and that's very surprising because there is no complexity from the clinical perspective into it. I mean, there is, but you can always kind of try to overcome it. So how do you kind of make that seamless for patients and consumers, so that at least they don't have to deal with the payment related friction? And then the post care, like whether it is care anywhere, hospital at home, remote patient monitoring, or care adherence in post care scenarios, because that's very critical in terms of medication adherence, reminders, and follow-ups. So with that, I know, like, I was almost like running towards the end of it. But this is what I wanted to present very quickly. Improve the lives of others while doing your life's best work at Optum. To explore career opportunities at Optum, work at optum.com, and optum.com for optum.in for more information. Um, Happy to take questions at this point of time. Let me just stop sharing. Okay, let me just very quickly see. Okay, there's a process related question, and then okay, introductions. How is AR VR virtual reality play a role in healthcare domain? Oh yeah, so AR VR definitely in some of the clinical care, some of the surgeries, some of the virtual interactions between the consumers and the providers. The virtual reality and the augmented reality plays its lot of role. It has already started. A lot of treatments are already happening in that direction, and then it will continue to scale. And I think the possibilities are numerous if you think about it. And that will be for a heavy close collaboration between the healthcare community and the health tech community to explore and build products around it. Okay. I think there is someone who is asking to join some community. Please do so. Yeah, so digitization intervention for health assets in the healthcare domain. Again, it totally depends on what industry you are talking about. But in India, I just last night I was at Manipal. I had to take family member there, and I was talking to one of the doctors in emergency, and they were saying that Manipal is far ahead in the digitization process, but where he was working earlier, the digitization was almost like negligible. So the digitization, is there are a lot of scope for it. We have still not done a lot of digitization in the healthcare industry, and I'm not talking about India, but also in many other countries as well. Although, like in some of the cases, like in US, for example, 90% of the claim processing happens through the electronic way. So things of those nature. So it's a depending on what part of healthcare you are looking at, you will have that answer. Uh, yeah, health data portability be a reality. Yes, definitely that's the target. I think all the all the industry entities and the countries are looking for how to make it really portable. How can we make entities to collaborate with each other, make the art of possible happen? So that's some certain. I would like to believe that it will really take off. It will really be the big thing. uh, and it is already, like, governments are very serious. They are putting regulations in place to ensure that entities do share data with each other. Okay, I'm trying to see a few more questions here. And SaaS players focus definitely on the consumerism front, especially on the digital front door and the the patient portals, and any consumer focused or even the provider focused the capabilities and products and platforms. I think there is a lot of SaaS play into it, and that's like that's already kind of, especially in the consumer space, consumer tech industry has already shown that path, and I think it will continue to spread into multiple other use cases as well. Okay, sounds good. Thank you so much. Looks like some of the folks have enjoyed the session. Yeah, and 5G definitely, industry is going to tremendously get benefits of 5G. And some of the areas where the digital adoption and the digital penetration for the healthcare related use cases which was pretty low so far, will definitely take off. And I think it's an interesting time, because I think, to me, the way I see it is the next wave of digital adoption will be in healthcare, big time. So yeah, value-based care. I think value-based care is pretty complex, and so it's not easy to kind of summarize in a simple sentence or so. But focusing more on the value which has been created by the provider during the procedure, and getting the reimbursements accordingly, incentives, or even getting disincentivized based on the value, is continuing to be the focus. The challenges there is, in some of the definition parts, right? Like, how do you define value in such complex ecosystem? And how do you kind of help providers make do the take the decisions in such complex contracting and such complex environment where the focus is on value, so they can't, like, quantitatively calculate like that. So therefore the analytics, the focus on data analysis, focus on predicting, and focus on smart contracts and whatnot is going to be very important. So thank you for asking that question. But yeah, uh, friction point, numerous friction points everywhere. Entities, are having friction on the care part, what is necessary, what is not necessary, in the payments, what was supposed to be done inpatient versus outpatient, 1 day versus 5 day, branded versus generics. Like, so there are a lot of friction points all across in the industry to kind of take care of it. So I know we have run out of time and so many questions. So thank you so much. And thank you for kind of joining the session. Thank you for liking the session. And thank you for all the wonderful questions today. Prashant, over back to you. I would like a copy of all these questions and I will definitely want to answer them offline.
Sure, Nitin, we'll do that.
Okay.
Okay, guys, thanks a lot for joining the session. Thank you, Nitin.
Thank you.
Thank
Thank
you.
you, Prashant. Thank you. Thank you, everyone. Thank you.